Is sparkling water bad for you in some way? Wait. Hold on. Sparkling water, per se, should not be harmful to teeth. DDS, MS, Assistant Professor and Director of Operative Dentistry Curriculum at the University of Alabama at Birmingham School of Dentistry, tells Self. The fear around sparkling water's effect on teeth comes down to the beverage's acidity. In 2016, although the study only tested a couple of sparkling water brands, it underscored what dental experts already knew: sparkling water is generally more acidic than regular water, according to the ADA. However, the notes, no research to date has found solid evidence that drinking normal amounts of sparkling water is more harmful to enamel, the hard, outer surface of your teeth, than drinking regular water. We mean sparkling. This doesn't necessarily mean you should guzzle sparkling water all day, every day. The pH could be on top of the natural acidity of sparkling water. Citrus-flavored versions contain citric acid, which lowers their pH and increases their potential to affect your teeth, Dr. Robles explains. Drinks with other if you're going to drink citrus-flavored sparkling water, the recommends that you have a serving all at once rather than sipping on it throughout the day, so you don't constantly expose your teeth to acidity. Beyond that, the recommends drinking fluoridated tap water if it's available where you live in addition to sparkling water. Fluoride is often. Overall, you can enjoy normal amounts of sparkling water without worrying about your teeth. The one major if you have a healthy digestive system, you generally shouldn't be nervous about how sparkling water will affect it unless you're strongly against. You'll probably let out some burps after drinking sparkling water, which is to be expected given that you're swallowing carbon dioxide CO2 bubbles. But the majority of that people with certain GI conditions may want to go easy on the sparkling, in part because of these gassy effects. That includes those. Dr. Chowdhury also tells his patients with conditions that already cause excessive bloating and inflammation like to cut back on acidic and carbonated beverages to avoid additional discomfort. Interestingly, a handful of suggest that sparkling water could actually help some people with their digestion. Theoretically, worries about this sparkly stuff directly affecting your bones don't hold carbonated water. The concern that overconsumption of sparkling water could cause bone health issues like increased risk of fractures and osteoporosis, weak bones, seems to stem from research showing an association between cola consumption and low bone density in women. MD, Chair of the Department of Rheumatic and Immunologic Diseases and Director of Education at the Center for Osteoporosis and Metabolic Bone Disease at the Cleveland Clinic, tells Self. Some do suggest a link between cola but not other carbonated beverage and lower bone mass density, as well as an increased risk of fractures, according to the NIH. It was first dairy milk contains high levels of END, which promote bone growth and help prevent osteoporosis in older adults, according to the dairy milk. And so, yes, swapping out dairy or fortified plant milk for sparkling water without making sure you're in vitamin D elsewhere could potentially heighten your risk of deficiencies and related bone health issues, Dr. Abelson explains. But this is a risk, the bottom line, unless you've got specific dental, digestive, or bone concerns and are drinking an absurd amount of sparkling water, there's no need to rob yourself of this particular kind of perfection. Hopefully, it
Raindrop, drop top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park, pot.